Hello, everyone. I'm Dr. Himani, and today I have chosen up a very interesting topic, which is GI disturbances or gastrointestinal disturbances in children on autism spectrum disorder. So, this medical condition, especially the gastrointestinal disturbances, are one of the most common medical condition which is most commonly found in children on autism spectrum. And the data and the research data which we have, published research data says that something like 3.5 times the GI symptoms or gastrointestinal symptoms are more common in children on autism spectrum disorders as compared to their typically developing peer. So, some of the symptoms which can be observed are pain and discomfort, and these symptoms can worsen the behavior of a child. Hence, it's very important then when we have a new behavior popping in, or when we have a sudden change in the way the child is behaving, we must look at, is there something wrong with their gut? Is there something wrong with the GI system? And most commonly observed conditions are chronic constipation and diarrhea, which needs to be taken care of. So chronic constipation or diarrhea is when the child is having constipation or diarrhea for a period of 2 weeks or more. Now, constipation can occur because of various reasons, like the child has a restricted diet, there is insufficient fiber in the food, they may be on certain medications which are causing constipation, they may have sensory or behavioral issues which are interfering in their toileting habits, which is again leading to constipation. So, a lot of times there can be some neurological metabolic problems also. Those we need to see our doctor, we need to get specific medical tests done to determine the cause and then treat them. Mostly behavioral management, like changing the diet, including more fiber in the diet, eliminating constipating food from the diet, building toileting behaviors, having a regular uh, time for the child to go and pass stools is very important. We can also use support of medications like soluble fiber and laxatives, which are easily available and can be prescribed by your pediatrician to treat constipation and its symptoms from time to time. If the child has chronic diarrhea, uh, like diarrhea again has to be for 2 weeks or more. Sometimes with constipation, child can have periodic bouts of diarrhea. That is normal. But if there is a diarrhea which is continuously happening for 2 weeks or more, then we need to think of more causes, such as it could be an infection, it could be an inflammatory or irritable bowel disorder. It can be a celiac disease, which means gluten intolerance. There can be certain food allergies, there can be lactose intolerance, or there may be excessive consumption of certain foods like juices. So again, when you have diarrhea, you need to find the exact cause and then manage accordingly. If there are food allergies, then those foods which are the child is allergic to needs to be withdrawn. Lactose intolerance, this lactose based diet has to be withdrawn. If there is celiac disease, that is gluten intolerance, then the gluten has to be taken off from the diet. And can be certain medications which may be required, which can be um, prescribed by your pediatrician to manage the symptoms of diarrhea and constipation. So, treating these medical conditions along with the core symptoms of autism spectrum disorder is extremely important, because sometimes these GI disturbances, gut disturbances can increase the behaviors, the problem behaviors, or unwanted, inappropriate behaviors in children to a large extent. And hence, we need to be aware, we need to be alert on these areas as well. Currently, a lot of research is happening to determine the cause of these disturbances. A lot of clinical trials and new research is happening on use of probiotic therapy, which some of the research has shown promising results in restoring the gut functions. However, if you find any of these symptoms in the child, please reach out to your pediatrician and get them managed along with treating the core symptoms of autism spectrum disorders. And if you have any queries related to this particular medical condition in your child, please feel free to reach out to us at Continua Kids, the details of which are given in the video below. And I hope this video has been helpful for you. Thank you.